Hey there, this is Mark with National Senior Advisors. Today we're going to be going over the basics of Medicare. And what is Medicare? Well, Medicare is the federal government program for health insurance with people who are 65 and above or people who are on disability. And at that point, you're going to have 80% coverage at any hospital, and at that point, any doctor that accepts Medicare patients. Once you have original Medicare, Parts A and Part B, Part A is something that as long as you've worked for 10 years and paid in taxes to Medicare will be paid up, so it won't cost you anything. But Part B of Medicare has to do with your household annual income. And right now for most people that's about $134 a month for 2017 at this point, and that will be taken out of either Social Security or a checking account if you're not drawing Social Security at that point. And basically at that point, when you have original Medicare, Parts A and Part B, again you're going to have 80% coverage at a doctor and hospital. Part C of Medicare is your Medicare Advantage plans. This is technically where you take your original benefits of Medicare, A and B, and you transfer them to another insurance company. At that point, you are sharing the cost with that insurance company on all your healthcare costs. You do not have original Medicare anymore at that point. You will not be using your Medicare card. You'll be using a card from that insurance company with a Medicare Advantage plan. A lot of those plans will have prescription drug coverage included as well, and that will be an all-in-one type plan. But do be warned that there are networks with those plans. You will be looking at HMO, PPO type plans, and you also will be looking at a max out of pocket where that can be anywhere from $3,000 to $6,000 a year. And then your Part D of Medicare is your prescription drugs. That is where you will get a prescription drug plan that is a qualifying plan through Medicare, and that will help pick up the cost for you for your prescriptions when you get those filled at a pharmacy. Those are the four parts of Medicare. Parts A and B are your original Medicare, where you get 80% coverage at a doctor and hospital. Part C is its own plan. It's standalone Medicare Advantage, when you decide to forego your Medicare benefits and transfer them to a individual insurance company to share the cost of your health care with them. And then you have Part D, where is your prescription drug. The last part of that is where a Medicare supplement comes into play, and that will help pick up the 20% of original Medicare. If you go with original Medicare, where we have 80% coverage, you can get a Medicare supplement that will help pick up the 20% that Medicare doesn't pay. Those plans will have a higher premium than what a Medicare Advantage plan would, but you do have much more comprehensive coverage at that point. I hope this has been helpful to you. If you have any questions at all, please let us know. You can give us a call at 866-541-0745. Thank you for watching this, and we'll talk to you soon.